So without further ado, we're going to hit the record button and get going. Okay. We apologize for a few glitches we seem to be having in technology today. So the talking voice you've been listening to is mine, and I'm Colleen Kaiser. I am the director of the Montana Dietetic Internship program.
I'm Anna Diffenderfer. I'm the assistant director and the lead in the Sustainable Food Systems concentration.
And I am Kellen Sarnoff. I am also an assistant director and the MS or master's coordinator.
And we have a new team member, and so I'll let Tracy introduce herself. We don't have a picture of her up.
Hi, I'm Tracy Hume. I'm the new administrative coordinator for the Dietetic Internship.
So, as I said, welcome. We're glad to meet you.
And I'm going to name her.
And we'll go to the next.
Yeah, Tracy's going to click first.
Okay.
So, as you hopefully know, with some of the information that you've been gathering and perhaps looking at our website and that, we our concentration area for the DI is and has been Sustainable Food Systems, and our new MS concentration area is Dietetic Systems Leadership. MDI, we have lofty goals perhaps, but not really. We believe this is where we're going. Our aims are to develop emerging professionals that think differently, think outside the box. They're confident learners and able to engage in their learning throughout the whole process, whether it's the master's preparation or in supervised practice. We believe that we are creating leaders in food and nutrition. Again, think outside of the box, look for problems and look at problems differently and look for solutions in different realms. We also aim to have those that leave our program be progressive and good critical thinkers.
Yeah, so for this upcoming year, we're excited to announce that we will actually be offering 2 different programs. So we have our new MSDI program, and then we're continuing our non-degree graduate DI program as well. So our new MSDI program, the emphasis is Dietetic Systems Leadership, and I'll talk about that a little bit in the next slide. Our MSDI is a 2-year program. Starting in May, so summer term, and it will go through May of 2022. The first year will be online coursework, and then the second year you'll go into your supervised practice, 40 weeks of supervised practice. The non-degree graduate DI, the emphasis is Sustainable Food Systems, and that's 40 weeks of supervised practice starting in August and then going through the subsequent May, and that should actually say May of 2021. And we'll talk a little bit about the logistics as far as where rotations take place. I did want to say that this upcoming year for 2021, or 2020 admits, it is a little unique in that we are admitting a full cohort for both of our programs. So about 26 slots are available for the MSDI and 26 slots are available for the DI. And this will likely be the only time that we enroll 2 very large cohorts. Now I'm just going to talk a little bit about the logistics for our master's program. Like I mentioned, it does start on May 18th of 2020. And you will do online coursework for the first 4 semesters. So that's a summer, fall, spring, and summer. And the unique thing about our program is that because it's an online course for the first year, you can remain in your home community or wherever you would like as long as you have internet access. And we do believe that it will be possible to continue working as well if you choose to do so. And then supervised practice will begin in August of 2021. And at that time, you would travel to Bozeman for your orientation and professional development. So the supervised practice takes place in Bozeman as well as surrounding areas in Montana. And then we do have a couple sites in Wyoming as well. So at that point, you would be coming to Montana. I posted a photo of the curriculum for the MSTI program. Our program is cohort-based, and the courses do have to be completed in sequential order. So what that means is that the entire cohort will take each of the classes together in the assigned semester. So you can see at the top there, the first summer is divided into 2 different sessions. So they're 6-week courses, but they are 3 credits, so they are pretty intense. And then you'll roll this fall and subsequent spring, you'll be enrolled in 3 courses, a total of 9 graduate level classes. We estimate about 20 to 30 hours a week of coursework and assignments. And I will note that it is not an independent study, so it is an online course, but there are deadlines each week, and oftentimes the modules or coursework will only be released in that week or maybe a week early. So it's not self-paced. There's still a lot of collaboration and teamwork and a lot of engagement with the faculty as well. And then I will note that we are a professional coursework only master's program. And so what that means is that our supervised practice and our coursework are intense and rigorous, and they do replace the need for a thesis or a capstone. So with our emphasis in dietetic systems leadership, we're really looking to build really well-rounded dietitians that have a thorough understanding of the food system and how it relates to dietetics. And we also want to give you a solid foundation in lots of different areas that are maybe a little, or that aren't as traditional. So for example, we do have an emphasis in research. You'll take a class in research methods, and then a really cool new course, critical thinking, research and evidence-informed practice. So we'll be looking at obesity in a lot of different angles. And then the courses that are bolded in blue, those are interdisciplinary courses, so courses that will be completed with other programs. So the health informatics course will be completed with nursing students, graduate level nursing students. We do have 2 courses related to policy. So family law and policy, and then state of the environment will be in conjunction with our sustainable food systems master students. We have a strong foundation in clinical as well, so a course titled Advanced Diet and Disease, so that will be similar to like a nutrition epidemiology course. And then a deep dive into medical nutrition therapy, deeper into nutrition support, but also a lot of different conditions that maybe you didn't get to cover in your undergrad course. And then with our focus or emphasis in food systems and sustainability, we'll be looking at food service management, but beyond just the kitchen, we'll be looking at community, school food service, and a lot of different aspects. And then we have a really neat course. The last course that you'll take the final summer is food innovation and entrepreneurship. So you'll be looking at product development as well as small business entrepreneurship.
So let's take a look at supervised practice. We have just an overview to give you an idea. You can see that in our first 4 weeks, we are engaged together. Again, this is part of developing a cohort, developing a team-based approach and support system for you. And we will begin orientation and professional development throughout the whole 4 weeks, and also Sustainable Foods Foundation work, so that you have a solid understanding that we bring the different, you come to our program often with different viewpoints or different preparation in sustainable foods. And so we work on this in that time period. And Anna's going to talk about that here in a little bit more. And then you have 2 weeks of applied foods in sustainable food systems. And in that 2 weeks, here we have it, it's linear 1 through 6, but actually we break you up into 3 cohorts. So it could be that you would do 1 through 4 and have another rotation for 2 weeks and come as a second cohort, or another 2 more rotations for 4 weeks and come as a third cohort.
And to clarify in this piece, this is the part that is common to both the MSDI program and the DI program. So for the MS program, Kellen did a nice job of explaining what the online portion looks like. This is the common piece when in that second summer when you would be coming to the Bozeman area. That's common between either program. Okay. Oh, you're going to talk about.
Sure. So along with that professional development, we again are looking to enrich your experience and prepare you to be in supervised practice. And so we have, over the last couple of years, done different tours in that. They'd give us, just give you a different insight into the healthcare system and being a dietetic professional. For example, in the one picture, we are at the Montana Blue Cross Blue Shield headquarters in Helena. We had a full day on understanding different aspects of insurance coverage and filing and coverage for nutrition services. We also have a team building day. I'll let Anna talk about that a bit more. We prepare you and we have a video workshop so that you learn how to do production videos and doing some different educational, instructional videos that you'll, different projects along the way. So during these weeks, we have projects, we have visits, and team building activities.
Okay, so I'll talk a little bit about what our concentration area looks like in practice. The foundation weeks, as Colleen mentioned, are directly following our orientation and professional development weeks. And we really do seek at this time to build that foundation from everyone's different experiences and interest levels and knowledge of sustainable food systems, and really talk about how as dietetic professionals, as food nutrition experts, this can be the lens that you look at all areas of practice through. So how does sustainable food systems apply in all areas of dietetic practice? And why is it important? Is a large emphasis as well. We do field trips, so we go exploring our food system around the Gallatin Valley. The top left picture there is at Barney Creek Farms over in the Paradise Valley. It's 40 minutes or so from here. And this is a small grass-fed, direct-to-consumer producer. So we learned about their practices, actually walked through the field with the cows and learned all about
grass production and how to do it works. Yes.
Right. And then we, so we look all the way from soil and grass production all the way through the waste stream. So the top right picture is the current class again at our recycling facility. And so we learned all about the different types of recycling, the challenges and opportunities in recycling. Actually, it was quite eye-opening for a lot of us. We spend a lot of good time learning with each other during this time. So we keep the large group together for those 2 weeks. And then in our smaller cohorts, we spend time at applying the concepts that we have just learned. And so we spend time at our student farm, which is Town's Harvest Garden. That's the middle picture there at the farm. And below that is the interns working at the Town's Harvest Garden campus farm stand. So they have two outlets. It's the farm stand and the Community Supported Agriculture Program, or the CSA program. And it's a 3-acre certified organic production farm, vegetable production farm. And the interns get out in the field and harvest, wash, pack, prepare produce, then sell it. So you get kind of the full experience. And we also, during that time, spend some time in the kitchen. So that's Kaylin on the left there. She's produced a beautiful cake in one of our culinary labs. So we get to play with the produce too and eat really good lunches together. We do also, each group has a project that we do in coordination with a community or campus partner. The top right picture there is last year's group. They worked at the Farm to School conference, which is happens every 2 years. So actually our incoming class this year will get to do that again. And then we, as part of, again, analyzing the different players in the food system, we work at one of our vegetable production facilities, processing facilities, called Root Cellar Foods. And that's Caitlin and Hunter peeling and getting butternut squash ready to put through the food processor. And actually, MSU is one of the biggest purchasers of the local food that's processed at Root Cellar Foods. So it's an exciting time for us to get to, as a smaller group, really start applying some of the concepts, and we talk in more depth about different topics related to sustainable food systems and how to navigate that in your practice. Also, another major component of our program is our culinary medicine program. We just completed our 3rd year of that program, and it is a required course now for our medical students, and it's optional for our nursing students. We had about 15 nursing students participate with us this year and 60 medical students. So there's 4 tenets that we run this program by. The interns run a nutrition education component session for the participants, really to provide some basic foundational knowledge of how food nutrition relates to different disease states and how it can be used as treatment and prevention, and how to really use the dietitian as part of the healthcare team. So the second tenet there is interprofessional education. So we are really focused on posturing our interns as the food nutrition expert on that healthcare team. So learning from, with, and about are the sort of coined ideas in interprofessional education. And so we really focus on that, learning with each other. We also impart culinary skills. So that's Marcy, who is also a chef dietitian. She's in our hospitality management program, and she's one of our partners in the program. And she does an overview of culinary skills so that our participants can practice what they're learning at home in their personal lives as well. And then we make sure that it's innovative and experiential. So we do, our first session is always at Town's Harvest, which is our student farm. And we do a tour and really talk about the connections between agriculture, soil health, plant health, human health, and how that all relates to the health of a community and individuals in that community. So we're really proud of that program and glad that it will continue on in the future.
Okay, we're going to look at some of the specifics and logistics of supervised practice. So we utilize the full state of Montana and also 2 different communities within Wyoming to deliver the program. And the reason behind that is Montana, we are a very large state in terms of land mass. We are the 4th largest, but we are small in population. We're just over 1 million people. And therefore, to fully capture the experiences that you need in a comprehensive care facility, we have you located or centralized in a majority of your supervised practice weeks in a particular location. And those locations are where we have larger hospitals, comprehensive care facilities. So that's Billings, Great Falls, Kalispell, Helena, Missoula, Butte in Montana, and Sheridan and Gillette in Wyoming. Every intern will also spend 2 weeks in a small critical access hospital. And in both of our states, these are major players for healthcare delivery, and especially a major player in rural healthcare. So each intern will also spend 2 weeks in one of those smaller communities. Rotation-wise, we are fully accredited to send programs, so we follow the requirements within that. So as you can see here, it's laid out. You'll have clinical rotations, 14 weeks, and cover all of the major disease states and information areas that you need, inpatient, outpatient. You'll also spend 2 weeks, as I said, in a rural hospital. And often the dietitian here is wearing all of the hats. They are typically the clinical manager, the food service manager, and the community expert that's involved with programs and different policy building, even in those smaller communities. 9 weeks of your time will also be spent in community rotations. Everyone will spend 2 weeks in a WIC rotation. There's a mix between early childhood, team nutrition, MSU extension, food access programs, pantries, and different areas where we have community involvement and nonprofits happening. What's good about this is these are somewhat according to the location that you've been assigned, whether you're in one of those main geographic locations, Great Falls, Billings, or what is there and happening within that community you get to be a part of. So the experiences may not be exactly the same in the 9 weeks, but they are all comparable. And part of what gives that comparability is that there are different assignments and requirements throughout all of the internship that lend to having baseline comprehensive experiences to deliver your abilities and competencies that you need to get. Food service management is 8 weeks. Again, everyone is in a K through 12 system, 2 weeks. Some will be in university systems, some will be in other types of food systems, and everyone will spend weeks in a hospital food service system as well. Okay. What is a very nice feature in our program is the 4 weeks towards the end of your rotations of the year that you get to really select and cultivate, develop. A lot of nice things here. You can put your own mark on your internship. If you have a certain area that you want to explore and expand upon, you can do that here. If there's a certain area maybe you hope to find employment in, it's a way to give a potential employer a look at you and your skills and what you can accomplish if you fit their team, what your interests are. If you feel that you would like to revisit some competencies and areas of practice you want to be stronger in, you can do that in this time period. And this is also developed by you, which is important because it's somewhat practicing skills of getting a job, because some of the same things apply. Contacting people, setting up conversations, setting up a plan, and delivering on it. So these are all good practice skills as well that happened in this 4 weeks. Okay. Talk about applications.
Yeah, so we're going to talk a little bit about application logistics next. So we do have a pre-select category as well as a national select category. So our pre-select category is open to MSU graduates. We assume that most of you are just going to be in the national select category. And we follow the DICA's application process. So the application is due by February 15th. You will need to complete the D&D match, and you'll be notified by the date of April 5th for the National Select. One thing that's unique about our program is we don't reserve a certain amount of spots or slots for our MSU graduates. It's really, we look at our applicants using the same criteria for both the pre-select and National Select categories. So our application requirements, the basic logistics are that you do need to have a proof of a bachelor's degree in nutrition or dietetics from an ASCEND accredited program, or have completed a post-bac didactic coursework from an accredited college or university. We do need a verification statement or a declaration of intent from a didactic program. And then we do look for 3 references from dietetic professionals, faculty, and or employers. As far as the GRE goes, for the master's program, the MSDI, the GRE is required, and I'll talk about the scores on the next slide. For our standalone DI, GRE scores are not required. However, if you've taken the GRE, you can send us the scores. We will look at them. And then it's not a hard requirement, however, recommended that you do have a preferred 100 hours of volunteer or work experience in food, nutrition, and or dietetics. However, if you're shy of the 100 hours, we do encourage you to still submit an application. And then there are additional requirements for the MSDI. Our graduate school does require an undergraduate GPA of at least 3.0. And if you have post-bac, so if you've done like a master's, you do have to have a graduate GPA of at least 3.0 as well. And then for the GRE score, we are looking for a preferred GRE score above the 40th percentile in at least one of the areas. So that could be the analytical, the quantitative, or the verbal reasoning categories. And then there's just info on where to send your GRE score.
The personal statement, this is part of the application. This is important. This is probably some of the most important writing you've done. You can see here and on our website too that there are specifics that we are asking that you address in this personal statement. The process for appreciating your applications includes a committee selection. And so we have 10 committee members this year that will be reviewing applications. And each application will be read and scored against a rubric by at least 2 people of that committee. And again, to note how important the personal statement is and how we value knowing about yourself or about knowing about you is that it's 40% of that rubric. Tell us your passions. Tell us how you fit our program. We are looking for that information from you. And it helps us determine if it's a good fit for both of us. Also then, each application is read by the team, the MDI team, all of us here, for different emphases. I look for overall fit, Anna looks for fit for the concentration area, and Kellen looks for overall fit and fit for the master's program.
So our program costs have been updated for the upcoming cohorts. We're very excited to announce that we do have an online graduate fee. So for both of our programs, that ends up being a really good deal. You can see, so this is just the MSDI program, and so you can see the difference between the in-state and out-of-state tuition, which is very competitive. And for the MSDI, we feel like this is a great price. I will note that you do pay a small amount of fees for doing an online program, but it's pretty nominal. And then on the second slide is the fees for the non-degree graduate DI, so our standalone DI. Again, there are some graduate credits, so there's 12 graduate credits that go along with the standalone DI, so you do pay tuition as well as our program enrollment fee for the supervised practice.
We do have financial aid available if, and as far as national financial aid, it would be dependent on your eligibility, but both programs are eligible for financial aid awards. Within that, scholarships for the DI program, for example, last year that were specific to MDI, we had 17 recipients of scholarships. And the application for these scholarships is opened up to the cohort, so no one else beyond MDI applicants are applying. And also, you're eligible for academy and other scholarships, and we ask that you seek for that, and we at least encourage you. And we've seen interesting scholarships come through from different communities, from different areas where dietitians work. So be open to looking at that. And it's pretty much every year we seem to have a national award winner of an academy scholarship as well. Okay, questions. Now let's see if we can get to the pane to see the questions.
So if you do have a question, you can submit it through the chat feature, and we'll try to get through all of them, and we'll read the question and then answer.
They're not showing.
So I think, Anna, can you see the questions? We might have to pull the questions up on a different screen.
We're gonna have to. What we could do is stop sharing our screen and just pull up the questions. Emily, I see you had a question there. Hold on just a second. We will try to get to our questions.
For any of you who, well, I guess if you weren't able to get the audio working, we will certainly send you the recording, and we're happy to visit with you individually as well.
So some people submitted under chat, and that's Q&A. So I think we just need to switch to the chat. Okay.
So we have both. There's questions in both. Go ahead, Anna. Why don't you maybe push it up to the top and read the first one? I don't know. Here you are. Can you hear? Okay. As a student,
Housing is the question. Can you explain how housing works for students who are placed in a region not near Bozeman? Is there guidance for students who don't know the state and anyone currently living there?
sure. So we have been cultivating a list of potential housing in different communities, and that list becomes available to you, and it has some past information. So what populated that list was interns who've stayed different places and gave feedback. Preceptors know you're looking for housing, and sometimes we've reached out to them if someone's having difficulty finding housing. We see Airbnb, we see rentals. Definitely interns tend to share housing, especially in the Bozeman area and even in the communities they get assigned to. That's that can work out well, and up to the individuals looking for housing. We've not had anyone houseless. It does seem to work out. We've had a couple that have had RVs throughout the year, and look, I have one that did that. He took his housing along with him when he went. In some of our rotations, our small communities, those rural hospital rotations, if available, we try to get you on the list within that hospital system for visiting healthcare students and healthcare providers. So, of course, if there's a healthcare provider that's scheduled for the housing during that time period, we get bumped, but that works out sometimes for those short rural 2-week rotations. Some of our rotations in Wyoming also help and have different housing times available. We work to try to get those. But housing is one of those logistics that is the responsibility of yours, and it can be a challenge, but we try to be as helpful as we can with it. As I said, sharing works well, Airbnbs, communications in those communities, all of those things together seems to get us there.
So one of the questions was if we plan on posting the recording. So the recording will be sent out if you signed up for the webinar. And if for some reason you don't get it, just reach out to us and we can send you the recording individually as well.
So there's a question about how you rank the science DPD GPA for applicant selection.
You want me or you want me? Okay, sure. So, as I said, the most important piece of the application as far as percentage is that personal statement. Everything else is scored, and there is count given to this. A lower GPA in the sciences does not exclude you. We do not use any of those types of measures for eliminating applicants. We appreciate and we value the time that you and energy, funding, all of the resources that go into the application. We read them all and we do score them all. It does not eliminate you if you have a lower science GPA, and we definitely look at all the other pieces. We're looking for a holistic view of you and not just one bit of information.
Can you provide more information regarding the rural health rotation areas?
So I think about Montana, it's pretty much rural health all over, but yes, we do have some larger communities, more urban communities versus rural communities. The 2 weeks in the rural hospital, perhaps that's what you might really be thinking about when you're asking that question. And this is a great advantage, I think, to see what life is in a smaller rural community. What kinds of things are challenges? How does the food system play out in those smaller rural communities? What do they have in access? Do they have gardens? Do they have their grocery store? Is it intact? We have food deserts in our rural communities, and looking at healthcare in all of those aspects of the smaller community, their economics, availability for food, access to food, healthy food access, and what's happening in the small hospital is important. Lots of times with that small hospital, there is also a long-term care facility, and that just gives another depth to what's going on as far as being a nutrition professional.
there any focus on community gardening, urban gardening, or herbalism in the rotation?
Go ahead, Anna. It's yours.
Yeah, I would say yes to all of those. Once you leave the really front-loaded exposure to sustainable food systems, you take that lens with you into all of the different rotations that you're going to be exposed to in the different communities. And so the opportunity to practice that in whatever rotation track you're in is definitely there. And you have the opportunity to really make the experiences for yourselves. Most of our communities, Montana is actually a very progressive state as far as sustainable food systems goes, because we are maybe small enough to be able to come together and make real progress, where in some larger states or communities, you might have more layers of things that you have to get through in order to make some progress. And so we're really lucky in our state to have those opportunities available to us. And so even if it's not something that's part of your specific rotation, there are opportunities in community organizations and state organizations that you can get involved with in all of these different areas. So the answer to that question is yes. Some will be specifically focused on in your rotations, and some might be outside of the actual internship experience, but certainly you can be part of community movements in this area.
Let's see, did we answer our rural and urban rotation?
Our rural and urban rotation experience is available.
Yes. So again, thinking about rural would be perhaps a good example would be those smaller critical access hospitals. Urban are our larger centers where we have a comprehensive care facility, and we have food service in those communities as well, K through 12. Sometimes universities. We have 2 universities that participate in our program, our own food service and food management, and so at the University of Montana in Missoula, for example. We do have rotations. There are some limited rotations in our Native American communities, and so you'll see healthcare there. So yes, we do have experiences in both sizes of communities.
And urban in Montana might
Yes,
be
that's what I say. Our urban is smaller, perhaps, than what you're thinking.
Yes, yes. So our largest community is probably just over 100,000 people.
Yeah.
Yeah.
Mm-hmm.
For the self-selected rotation, have people ever spent it abroad?
Yes. I can think of one individual who went to Honduras and worked at an orphanage there. Spent a few weeks concentrating her efforts in helping them implement sustainable practices within their food service system, and then other weeks was in the clinic side of things. So that's one example. We've had interns have gone to Hawaii, which is not necessarily abroad, but it is. It might feel like it, and did some unique things there as well. Canada, we've had interns that gone to Canada as well.
Yeah, and we have a connection with someone in Italy working for the Food and Agriculture Organization, and one intern was working toward that, and then was turned out unable to be able to do that. But the contact that we have there was more than willing to have an intern with them. So sky's the limit. Anything you'd like to do.
Pocketbook usually is what limits you.
Is there a more comprehensive list of rotation locations and each of their objectives? I would say on our website we have
some example of tracks, what each rotation and where it is. As far as objectives, probably you will see those more if you look at sample. I don't know if we have any sample assignments. Assignments are driving some of those. There are things to be met as far as competencies in each rotation, and that is a master log that you will be keeping, and there is accountability paperwork that helps us guide you through that. But other objectives are clearly viewed in different assignments throughout the year.
Okay. If I'm applying to the DI program in the spring, would I be able to continue on to complete the master's program in the year after if I decide to pursue that, or would I need to reapply?
So our master's program is newer, but maybe I'll let you want to try to enter that one?
Yeah, so currently the way the program is set up is the MSDI does have the MS portion first and then the DI second. And that's how we'll roll out for the first year. However, one of our goals is to have a master's program option as well, which we would first offer to prior DI graduates. And so in that sense, yes, you would be able to complete the DI and then come back potentially at a later time to complete online coursework to get your master's degree. However, we are still working out the logistics and can't make any promises to when exactly that would roll out.
The specifics of that are yet to be determined.
Yeah, but it is a huge goal of ours, and we are working towards that for sure.
Yeah.
Okay. How firm are the rotation weeks? Is more or less time allowed according to interns' goals?
The expectation for supervised practice is 35 to 40 hours per week. And then on top of that would be your assignments and different projects that you're doing for class. We do have a nutrition 598 class where we meet once a week in a virtual format like this. And as I was mentioning, assignments along the way. That 35 to 40 hours per week doesn't mean you're hooked to the preceptor's hip. They might have you on projects or assignments that they are having you do, and those hours count towards 35 to 40 hours per week. But the expectation is 35 to 40 hours a week, and that's consistent throughout the 40 weeks.
And as far as like the placement of where you're going, the locations, if you look at that, we have 26 interns and a lot of different spaces, and most interns are rotating at 10 to 12 different locations. There's a lot of coordination that goes along with that. So once you have your schedule of where you're going, it is pretty set. There's sometimes we do have to make changes, but we don't make changes just because you're more interested or really wanted to go to a certain area. That's part of the question as well.
Yes.
Yeah.
So it is a set. Life happens as far as changes, even in preceptors, things happen, but it's, as Kellen said,
it's a pre-assigned track.
It's a pre-assigned track.
As directors, what about this program makes you the most proud?
Lots of things, I guess. Most proud is of all of our graduates. They're doing amazing things. I feel a lot of respect for the people who've come through our program, and I feel proud that they think differently in some realms of, they're looking outside the box, they're looking for solutions, and I think they're game changers in the field of dietetics, but also game changers in communities where they live. So I feel proud of the people that come out of our program.
I'm new, so I just started in July, but I'm really excited about the program. I think something that we do really well is we really allow our interns to try a lot of different rotation areas, and we partner with a lot of different organizations in each community to really let interns explore a whole bunch of different areas in dietetics, or even loosely related to dietetics that dietitians would really excel at. And I think we do a really good job of helping you like expand your viewpoint of what dietitians can do, and kind of plant the seed that you're really capable of going into a lot of different areas. So I think it's really unique aspect of our program.
And I would have to say I'm most proud that we are developing leaders with a really unique lens to approach practice with, that we really emphasize systems thinking and thinking about all the different components of what goes into health, and really providing you with the skills and tools to put that into practice, and be really to look at problems and come up with really creative solutions that might be different than what we've been doing in the past. To start maybe moving the needle a little bit in some of our health indicators. So that's what I'm most proud of. When would be the best time to schedule an on-site campus tour?
We're
here all the
We're here all the
time.
time. We are taking a break this year at Christmas.
Yes, not in the next 2 weeks.
Not in the next 2 weeks, perhaps. But starting starting January 6th forward, anytime, just contact me and we'll try to set it up. That'll be great.
We'd love to have
Yes,
people come visit us.
we do.
Is it important to have a letter of recommendation from an RD? Yes. Have some experience, but limited. Feel the other letter writers would know me much better.
The letters of recommendation, what's important is if somebody knows you well, what we read, their impression of you, their impression of your abilities, their impression of you being successful, we value that, and that's important. Included should be, for sure, one academic reference. That's important. Otherwise, it's not. If you have a dietitian that knows you well, because they can connect it to and speak to your success, that you will be successful in the career track, that's great. If they don't know you well enough to do that, I think we'd rather hear from someone who knows you well.
Have your master's students written any publications or thesis work? If so, what are some examples of their research?
Yeah, so this is the upcoming class is our first year that will have the master's program, the MSDI. And right now, as the program stands, we won't be requiring a thesis. That could change in the future. We might add that as an option. And then we do have some students that are coming to us and they've already completed their master's and have publications, but none that have come from our program currently.
Can you share an experience from previous intern graduates that identified something they wish they knew and what they know now before going into their internship? In other words, what would they have done differently to set them up for success going into their internship?
I'm trying to think.
Yeah.
That's a good, you're stumping me on that one. That's a good one. The flexibility is big. Perhaps that's one piece. When we talk about fit, we do look for fit that you are the right person for our program, and our program is the right person or right for you. There are logistics and challenges, but if you are that person that has a sense of adventure, wants to see different community sizes and how healthcare plays out, has flexibility to handle logistics, things that can change sometimes. I think really understanding what that means, that flexibility and challenging logistics, comes in with an eye that says, oh, okay, this might be a little different than I thought, but it's okay. And I guess on top of all that is the individual who is seeking the best from this experience and are actively engaged in cultivating those good experiences for themselves, no matter where the rotation site is or what's going on, but they're looking for all ways to improve them and enhance their learning. Those are the good fits. And that's the true lens to have, is to be open, because you might have one impression and think it'll be one way, to be able to flex and be open to say, oh, it's a little different than I thought, but there's still a lot of good learning and experience here.
Is the approach of health at every size part of your curriculum?
We have definitely, yes, we have a session coming up this next half on that. We have past interns who are delivering that session, and that's where they're working, is in that arena. And
I believe they got exposure to it
in our program.
In our program, we have in the professional development weeks, we have a variety of different professionals, and that usually is a topic that is addressed, as well as mindful and intuitive eating. We do sessions on that as well. And I anticipate the obesity class as part of the master's program, will have a heavy emphasis on health at every size.
Yeah, I think there's a section that's dedicated to intuitive eating in that course. And then in the advanced MNT course, there's a section dedicated to counseling, motivational interviewing, intuitive eating. So we'll definitely talk about it.
Mm-hmm. Was the hand up for anything? There was one hand there.
And that was really it.
Okay.
Here. What is the program's pass rate for the registered dietitian exam after program completion?
The first year pass rate is 88% right now. We have a newer, CDR has a newer exam in place the last 2 years. In all across the United States, we saw a dip. Previously, we were in the higher 90s, but we're also seeing our pass rate go up.
Yeah, the trend is up, and we have a full day workshop that is dedicated at the end of the internship during our graduation. We dedicated to preparing you for the exam. And then this year, we also have incorporated sessions throughout the year focused on preparing you for the exam. So we've addressed a downward trend that we saw in the last 2 years by adding in more exposure and more rigor to our preparation.
More practice.
More practice, yeah.
Preparing for it.
Yeah. When do interns find out what the pre-assigned track they're assigned to is?
That's a good question, and it brings up one more statement we should make is when you apply to the program, you are asked to identify a first and second choice as far as locations for the majority of your rotations. That would be those different cities and towns that we were talking about. Across the 9 years, we've met everyone's first and second. I've never gone past that. However, we also get a number, especially from out of state, that say it doesn't matter, and that's very helpful. That does give ease of putting everyone. If you have someone that you know in a certain location and have housing opportunities or lesser cost housing opportunities because you know or have a family member, we definitely try to honor that. Let me know that. That's important in the process. You will know once you've been finalized that you're part of the next cohort, that cohort for the DI, you will know your housing or your location within the week. The actual week-by-week track comes in late May, early June, but you will know your general location within a week of the final cohort decisions.
Double checking here.
Did we get them all?
We have answered all the questions.
And again, if you think of something later that you were burning knowledge about, would like to know, email me and we're happy to answer that. We're happy to talk to you in person if you'd rather at some point. We are excited for the rollout of our new MSDI, and we look forward to that, and also excited for another cohort of the DI. So we look forward to seeing your applications. We thank you for your time now, and it was kind of fun to do this. We can't really see you, but that's okay. And again, if we can be helpful along the way, don't hesitate to contact us. Thank you for your time, and we will probably sign off.
Yeah.
Okay.
Thank you.
Thank you. Bye.
Bye. Happy holidays, everyone.
Yes.
Just make sure you stop the recording. I don't know how to do that.
Yes, stop.
Okay. You might have to leave, maybe.
Usually you can close it.
Thank you so much. Thanks so much.
That's nice. I'm gonna close you out to see.
Yeah,
It shouldn't be. All right. And